welcome to the new episode of Brain Attack series. Today we are going to be talking about the role of a speech language pathologist and what they do in the management of a stroke. So this can be in terms of their speech, their language, their swallowing, their awareness and their cognition.
Speech, language and communication can be affected in stroke patients. So irrespective of a clot or a bleed in the brain, these three things can be affected. So we'll try to understand what is speech, language and communication. So any exchange of information is communication. So this can happen verbally or non-verbally. Verbally is when we produce sounds or when we say a meaningful utterance as verbal production. Non-verbally is like giving handshake or sign language or gesturing, head nods, smile, emotions all can undergo non-verbally. So now what is language? So when I have a meaningful communication, which could be either like by writing or by talking, can come under language. Now speech is the verbal production. So if I am speaking well, basically my speech is good as well as my language is good. But you see in few patients where the speech is not clear but they are speaking meaningfully. That means their language is intact but speech is disturbed. So this is how we understand the difference between speech, language and communication. So because of stroke, either only the language can be affected and the speech can be intact where the fluency is good, the articulation or the pronunciation is good, but otherwise it can also be speech and language both can be affected, or only the speech is affected and the language can be good. So any of these three can manifest in any sort of strokes. These problems are usually seen in the left sided stroke. I mean, if the stroke happens in the left side of the brain, so these three problems are seen. So so basically when there is a stroke, speech language pathologists play a role either in acute care setting or in a chronic care setting. So in acute care, now the patient can be in comatose stage where the patient is not conscious or awake. So in acute care setting, now the patient can be in comatose stage where the patient is not awake or conscious. So here the speech and language pathologists use different techniques like auditory stimulation, speech and language stimulation to wake up the patient or to improve their consciousness. So once the patient is conscious and if he is still in the acute care setting like ICU or wards, now we can work on functional communication training. Now what is functional communication training? To make sure the patient is able to communicate with the immediate members or with the immediate environment. So we should make sure the patient is able to ask for his needs, maybe with the attenders or family members or with the like nursing care. So this is one way, and simultaneously we can start treating the respective problem. If there is a problem in comprehension, that is understanding, there are several techniques to improve the understanding. And if the patient has a problem in expression where they are able to understand everything but they are not able to communicate properly, then we can start treating them at this level. And next comes communication, where they are not able to understand also or they are not able to express also. So overall communication, either we can train the patient to communicate verbally or non-verbally. So this is how we treat in acute care settings. So next comes chronic care setting, is where the patient is discharged from the hospital but their speech, language or communication problem is still persisting. So these patients can come on OPD basis to improve their communication skills or to improve their comprehension skill, that is to understand what is spoken to them or to help them to express. So while working on expression, we can see patients who just have one word utterance, that is they try to communicate just in word, they are not able to frame a sentence or a phrase. So there are a few techniques where which will help in improving their length of utterances, or they're like fluently telling but it makes no sense. So there are other techniques which will help the patient to make sure that they're communicating meaningfully. And if the patient is not at all able to understand, there are a few techniques which can be used to make the patient understand what is being spoken to them.
So now you have seen what is the role a speech language pathologist plays in the rehabilitation for speech and language problems where they are having difficulty in talking, clarity issues, understanding, etc. So, in the upcoming video we will be talking about the swallowing issues, how that is looked at, how it is assessed, how it is treated, what are the, how can you find out if somebody is having a swallowing issue, etc.